What is hypnobirthing? Are you trying to find the right choice for your birth experience? How do you know you've got the right care provider? What are some of the big misconceptions of hypnobirthing? Is hypnobirthing for you? Join me, Nara and Nemira, for this empowered pregnancy interview with Elisabeth Hobbs-Hubach, where we talk about what hypnobirthing is and whether it's right for you. Are you ready? Welcome to the Empowered Pregnancy Interview Series. I'm so excited to have Elisabeth Hobbs-Hubach here with us today. She is a certified hypnobirthing childbirth educator who runs her own company called Holistic Birth. Can you tell me a little bit more about yourself, Elisabeth?
Hi, thank you, Nara. Well, like you mentioned, I'm a hypnobirthing certified educator, and I got into this because I used hypnobirthing for my first baby, but also my second one. But my first one, I was like pregnant about 3 months along, and hypnobirthing got recommended to me, and I knew I had to have my baby. I hadn't really thought about how to have my baby, if that makes sense. And I read the book. I loved the philosophy in it and the information, and so I took the class. And I thought it was just wonderful. In the birth of my son, I felt empowered. I knew what was happening, and it just is a wonderful experience. And then I really sort of started paying attention to other women's birthing stories, and realized that not every woman has a wonderful birth story. And I thought, you know what, I really would love to share this with other women. Just empower women to have choices in their birth, choose to care, just have big respect about a care provider, and just have a really positive experience, because birth can have such a profound effect on women, how they birth. And so it's important it's positive. It's not necessarily like I've got a plan and it's going to follow the plan, but more like, I've had choices, had a care provider that listened to me, I had people around me that I could trust. Just it leads on to such a wonderful experience afterwards that it was a great place to start. And then I just love what I do and how I teach birthing couples. It's wonderful.
Right, so if you're a woman who say is just in their first pregnancy and they want to learn more about hypnobirthing, where do they even start? What should they know?
That they've got choices, and to looking for a childbirth education program that suits them. I say hypnobirthing is wonderful, but it's not necessary for everyone, perhaps. But the ones who love it, who really, you've got to really believe in the philosophy that the childbirth education program giving you. So look for something that works for you. Ask questions, and just find out what works for you, and get kind of educated in your birth and what choices you have in your pregnancy and during labor. Because what a lot of my first-time mums say to me is, well, they'll sit through a class, well, I didn't realize I could actually birth squatting or birth on all fours, because that's not what we get. That's not how birth's portrayed in the media.
In the media, you're always on your back, right? Which
exactly.
So many women that I work with, they're like, oh my gosh, you don't have to be on your back.
and it's a simple choice like that it can be so empowering to women. Say, okay, I'm not actually, birth doesn't have to follow the exact plan that's portrayed in modern, in society. And I actually, birth is something I can have a choice in, and that I can, even locations say, well, I actually don't have to be in a hospital. I can be, in a birthing center at home. And, sometimes even babies decide to come in the middle, in the car on the way to hospital. Just knowing that the possibilities, women just feel that more confident about birth and pregnancy. And pregnancy is you've got 9 months, which is a great amount of time to sort of like prepare yourself for labour and birth, and for what happens once the baby's here. So yeah, that's what I'd say. Just start looking at choices early on.
You say it's a lot of time, but it actually goes so quickly on the same time.
Well, yeah.
You're like, oh yeah, well, I've still got 6 months to figure this out.
Yeah, that's true, very true. And that's, for the first one, you're like very much concentrated on that pregnancy. For the second one, third one, and so on, it goes so much quicker as well because your focus is somewhere else.
Yeah.
So yeah, I think from the moment even before you conceive, is maybe start looking at what your choices are, and
That's very good. Yeah, it's never too early.
No.
Aging in your options. And I think the other thing is to start looking at what care provider you want to use, because
absolutely.
Because part of what Empowered do is you want to make sure that you find a care provider that gives you the options that you want. You don't want to feel that you're being kind of pressured by them that, oh, you can't have the birth that you want. You make that choice.
Absolutely, and that's a very powerful choice to make. I'm based here in Houston, Texas, so we've got some wonderful care providers in terms of it's a medical hub here. So unfortunately, the C-section here is like 33%, which is really high.
That is really high.
And it's so easy to start off with a care provider that that's not comfortable in supporting you in your birthing preferences, and you end up with a birth that you didn't want. You don't feel like you were supported in the way that you felt you didn't want to be supported. And also, it's having those choices. And so we in the hypnobirthing classes, we go through your birth preferences. Starting off with going into the hospital, the triage, how do you want to be treated, and starting the conversation with your care provider early.
Yeah.
So I had recently a mum who wrote her birth preference out, and talked to her care provider. So her first one on the list was that I want to be able to walk around, during labour. I just want to, and the birth care provider goes, no.
Oh, right?
And she said, okay, well, she felt empowered and confident enough to say, okay, well, this is not for me. And she actually ended up choosing a home birth, which she felt comfortable in, and she had a wonderful birth. And we're not asking care providers to change the way they support women, because that's what they're comfortable with.
Yeah.
It's about empowering birthing couples to choose care providers that will support them.
Exactly.
And what I say to moms, so they might be saying the right words, but if you walk away from that room and you just get a niggling feeling, trust that feeling.
Yeah.
Trust that feeling that there's something wrong. You don't have to understand it, but go in and just interview other care providers and see what other options are available for you, because it's so powerful. They have such a powerful impact on how your birth will be.
And that leads to so much more post-birth as well, and that's one of those things that for me, I think it's important to ask the right questions, but then it's also, I love statistics, and I love things like actually ask that birth provider, so what is your cesarean rate, right? If they have a high cesarean rate, they might be telling you all the wonderful things you want to hear, but they also have a high cesarean rate, so let's see what your options are. What
exactly
happen.
Exactly. And it's not to say that C-section isn't necessary in emergencies, but if that's not the way you want to be going, it's important to choose a care provider that will look at the more natural ways of sort of caring for you before going into that option.
But it's about them being in line, because not saying that having cesarean birth is bad or anything like this, but if you're one of those people that, oh, well, the cesarean is my last resort, then you want a care provider that's at that same level with you.
Absolutely.
Then you're not going to get the birth experience you want. So it's about trying to find someone who aligns with your values in your birth. And that will vary from couple to couple. So it is about shopping around. It is a little bit about finding that out.
Well, exactly. And I think, especially as a first-time mum, it's so easy just to fall into like a care provider. This is the obstetrician. This is a gynecologist I see, so they do obstetrician. So that's what I'm going to go with them. And that sort of, they think that's that's what they have to do rather than look around. And yeah,
they don't even realize there is a choice.
No, and especially here in Houston, because it's very much OB obstetrician based, that the option of home birth and sort of birthing a birth center is sort of, you really got to start looking into it and asking the questions and knowing to ask the questions.
Yeah.
Because you can't be asking the questions if you don't know
exactly
the options are there. So
it is. I mean, because I know here in the UK it does vary, and part of it is the UK actually has entire home birthing teams as part of the NHS. So there are groups that are from the National Health Service here that are almost entirely home birth based, and they actually. I mean, because right now, obviously, the NHS is quite crowded, especially in parts of the country. So they're like happy if women are healthy enough to have a home birth, and then when they have a birth, that takes them out of hospital bed. So it's actually, I think it does depend, and I know that it's a state-to-state thing a lot of the time as well. What is more comfortable, what's more common, and what's more accepted. There are plenty of countries where home births are actually the norm, and a hospital birth is only when there's a need for it. So don't assume just because you're being told by everybody around you, everyone, you also get this like pressure from moms and like in the grandmoms and all that thing that this is how their birth went. So you were born in a hospital, so you should be born in a hospital, and that you know what I mean, that kind of thing. So don't feel pressured to that. There are so many more options than we are normally exposed to.
Absolutely, and that's the thing, sort of what we see in our births of our friends or births of our parents or whatever. That's what we think birth should be like, and program, media, and everything that surrounds birth really doesn't portray birth in a realistic light. It's realistic to the people who have that experience, personally, but it doesn't have to be your birth experience. And I think women need to realize that they can actually choose how they would like to approach the birth of their baby. It's their baby's journey. It's their journey.
So I want to get back on hypnobirthing, and I'd love you to talk a little bit more about that. So if somebody's having a hypnobirth, and what would they have in the hypnobirthing experience, for their birth experience? What would they want to prepare for, and what kind of things would they expect if they're brand new to this?
Okay, so in hypnobirthing, we've got 6 sort of main sort of ways we sort of help women. First of all, is education. How does our body work during labor and birth? What's happening with the baby? Just if we get consciously know what we're what's happening in our body, it helps relieve any fears that we may have, what's going on, so we actually know what's happening with our body. Second of all, we've got breathing techniques. Breathing is so important. Just when we feel tense, we lose our breath. And hypnobirthing is very much about teaching women how to relax during birth. That might sound like an oxymoron, but if we relax, and our body has this innate knowledge of how to birth our baby.
Yeah.
We let go of all our fears and everything. We get in touch with what our body's saying, what's happening with the process of labor and birth, and we work with that. It's just so much comfortable, and more comfortable, and women feel so much more in control.
Yeah.
So we talk about relaxation. We teach women how to relaxation techniques. We do visualizations, affirmations. Replacing those negative self-talk with positive messages. And I do. And sort of we also go into sort of nutrition. Nutrition is so important, because what you're taking on as a mum is going to your baby. So you want building blocks for your baby. Sort of you provide that nutrition to your baby, healthy nutrition. So your baby can have a start in life. It also helps in labour and pregnancy if your body is energized. Also looking at the exercise you're doing, and how you're taking care of yourself is so important. So it's all encompassing, and we'll also talk about once the baby's born about breastfeeding if the mum chooses to be breastfeeding, and what's going on with the baby in terms of the meconium coming, and so the mum has an understanding, which is so important about what about birth, and what she can do to help the whole labour process and the whole labour experience, so it's more sort of comfortable for her.
Yeah, so because knowledge really does give you so much more power in this, and it's very unexpected, which can throw you off in the birth process when there's something that you're like, oh, I had no idea that was going to happen, or even more, I had no idea that could be uncomfortable or painful, and that they were going to do that. And so I do find that knowledge is one of the most important things with this, is that having that is, as I say, empowering.
No, absolutely, and it's empowering. It's letting them know that they can actually ask questions about it to their care provider. If the care provider says, well, we've got to do this, or okay, is it necessary at this time? What are the benefits? What are the risks? Will it lead on to something else? It's being able to have that conversation with. So it's not it's a two-way street. The doctors, the care providers have the knowledge, but you're empowered to ask those questions and have a say about how you want to proceed, how you want to go on. So.
And I do think that it is. I think you should always be asking questions. And this is one of these things that when I work with health professionals in these kinds of things, I always find, because I have a background, I have a degree in science, and the moment you say, I actually understand what's going on, can you talk to me? Like, don't dumb it down. Talk to me like somebody who's a colleague. The way that their entire demeanor changes. So if you go in there educated and you say, you know what, I know a lot about this, I know a lot about this, and you ask something specific, you will be amazed how well that your doctors and your midwives and all these things can answer you, because they feel as though that they're actually able to give you that information, but that information is not going to scare you. So I think coming from an educated side is actually brilliant. The way that health professionals respond to it is actually, it's such a different feel when you go in there and they think you don't know anything.
Yeah, absolutely. You have those conversations that you wouldn't have ordinarily with your care provider otherwise. Definitely. So yeah, that's hypnobirthing. I think I've sort of encapsulated. It's very much sort of having a care provider that you trust. We also sort of, hypnobirthing also gives techniques on how to help mum, so the birthing partner knows how to support the mum the best. Because a lot of sort of birthing companions or partners, they come to class and say, what am I doing here, first of all?
Yeah,
I'm not the one having the baby.
Yeah.
And sort of, what am I meant to do? How did I say? So we give, we teach birthing partners how to sort of support mum. It may be. So I tell her that it might be just a simple thing, as just holding your hand.
Yeah.
That's all mum needs at that time.
But that is actually still huge when you need it. You know what I mean? In that moment, that is, you are being the world to mom at the moment, because she needs that. And I think you're right, entirely supporting is one of the things that's often forgotten, is that we assume that the birthing partner is just going to, be able to do all this, know what to do. And often they're more lost than the mom, because at least the mom has the inherent instinct in her body to give birth. They're there watching, and they don't know what's going on. So they need to be as educated as much as the mom. And I do think that it's a partnership for a reason. Oh,
absolutely. And it's what was I going to say? And it's not during labour that they have to be present. It's also bonding with the baby whilst mum is pregnant. We have a class that we talk a lot about the bonding, and prenatal bonding is so important for mum and the birthing partner to be involved, to talk with the baby, to play with the baby, include the baby as part of the family already.
Yeah.
It's so important, so powerful. And then the birthing partner, just being in the labour room with mum is just a continuation with that. Practicing all with mum with like the birthing scripts, the relaxation scripts. It's the whole pregnancy and labor thing, just how it happens before the baby's actually even there. So it's just, once the baby's there, it's just a natural continuation of what they've been doing anyway. So yeah, that's what I love about hypnobirthing. It's just so much, preparation, not just for labor, but afterwards as well.
Which is the bit that I think is, again, forgotten a lot of the time, is this. So I do find a lot of the time it's like, once you've given birth, oh, good, bye.
Yeah.
Like, there's so much more that from this point on, it's like a whole new world of more things that you need to think about and be worrying about. And the mother's body is still important, right? There's all of those things. So I do think it needs to be continuous. And
definitely. And then it's just, a lot of, like, when I had my son, I didn't realize women bleed like 6 weeks 6 weeks afterwards. It's like, no one tells you these things.
There's a lot of things that nobody tells you. But there's part of it, I think, it's because people wouldn't talk about it. People don't want to talk about that. People don't want to talk about incontinence. People don't want to talk about all the things that you can often get. And there's no reason why women don't talk about it. There's no reason why it's kind of not. It's not the kind of thing that's attractive to talk about in the media, so they don't talk about it in the media. But there's no reason why your friends shouldn't be talking about it. There's no reason why your mother or your grandmother or the women in your life or your women's support system shouldn't be talking about. And I find that's actually one of the problems with birth, where there's so many misconceptions, is because the things that weren't so pleasant or the things that people were kind of embarrassed happen to them, they don't tell anyone. But you're like, but it happens to everybody.
Yeah. And I think once the baby's born, the focus is on the baby, and
the mom who still needs to cover, and is breastfeeding, and is integral. Like, there's so many things, and that's what it's one of my things is I'm huge on recovery, because I think the recovery is just as important, especially for a mother who wants to say have other kids, or I mean, there's lots of other things, but just even have a pain-free, productive life. They need to recover correctly from their birth, and often it's like, well, all that matters is the baby, and you're like, well, no, the baby matters, but they're not the only thing that matters.
No, and I find that if mum is well, then she's able to give to her baby.
Exactly.
That's why I've actually become certified in teaching hypnomothering. So it looks at
wonderful.
The continuation, sort of looking at nurturing herself, mum nurturing herself, and giving her techniques how to dealing with the baby that won't stop crying. It's like you have to calm herself so she can actually calm the baby. And I think that's really powerful as well.
Absolutely wonderful, yeah.
Right.
So there are a lot of misconceptions about hypnobirthing, and I wanted you to kind of have a chance to talk about them and where people might be going wrong with those.
Okay, so the first misconception I think would be like the hypno side of the hypnobirthing. Hypnosis, I think, gets a bad rap in some ways. There's a lot of misconceptions because a lot of people think sort of like dangling pendulums or the stage shows that have been on TV, and that's an aspect of it, but that's not the hypnobirthing sort of thing. If you think about when you make a car journey, you drive from one place to another and you don't remember that journey. You've been in a state of sort of dreamlike, sort of, you're paying attention, but your subconscious is somewhere else. Or, you've been reading a book, you're doing something you really enjoy, and the time goes really quickly. And that's a form of self-hypnosis. And if something were to happen that needed your attention, you just snap out of it just like that. So what hypnobirthing does is hypnosis is just like a really deep relaxation, like really super deep relaxation. And we use that in hypnobirthing to, first of all, that means mum's really relaxed, which means she's allowing her body to do what it is designed to do. Secondly of all, we use that to help her replace those negative messages about birth with positive ones, because then your subconscious is more receptive to receiving those messages. During labor, it allows mom to get in touch with her birth body, get in touch with her baby, and focus on just letting go. letting go is so important, just to let everything happen, because I think society nowadays, you feel like you need to control everything, and it's just allowing things to happen. So that's what the self-hypnosis side of it does. Also, I think misconception is that, it might be something that's pain. Hypnobirthing makes birth pain-free, and that's, no program can promise that to women, because everyone experiences pain or discomfort in a different way. By relaxing, you allow your body to do it, so you're not fighting what your body's laboring. You're not fighting the laboring process. So working with your body allows that to be more comfortable. And we say it's about being more comfortable, and you focus on your breath, so you're focusing at the breath, or you focus on the visualization, and it's just you teach a lot of methods or sort of techniques and how to sort of change your focus onto the positive bits of the labor, and sort of work with your body rather than the fighting it. Sorry?
Rather than fight it, work with the
Absolutely. And so it's a more comfortable way of birthing. So definitely. And also it's also what focus we put on that. So if someone comes up and says, how on a scale of 0 to 10, how painful is that? If you flip that on its head and say on 0 and 10, with 10 being the most comfortable, how comfortable are you?
Yeah, change the way that you're thinking about it.
Yeah, so it's a level of discomfort rather than a level of pain. It really helps sort of with that. What other misconceptions? Sorry.
That's right.
And that moms must. Hypnobirthing is about having a really silent, quiet birth. It's actually, hypnobirthing is allowing you to birth in the way that you want to birth.
Okay, so because I know that's the other one. I was like, so everybody has to meditate and be absolutely silent during the birthing process.
No, it's about if whatever helps women keep their focus on what's happening during labor is what what works for them. It's not. It's going with it's but giving birth is a sort of a very instinctual thing to be doing, and to say to women, oh, darling, you've got to be quiet, is just, and that's going against what the body's telling her. Then it's not. It's just go with what presents itself and what your body feels like it needs to go through the process. And that it's also the misconception that if you're thinking about having an epidural, or you're thinking about you're wanting a C-section, that hypnobirthing isn't for you. It's actually really helps moms. Even moms that they medically need a C-section, and if they take the hypnobirthing classes, they're able to relax, which allows their recovery to be that much more happen so much quicker and so much more comfortable, and so much she's thought about is a choice that she's making. It's just all a lot of mind and body, and just it's fantastic. It's not because you're having medical interventions that you have to do childbirth classes.
Because I've never actually, because I actually was one of those people. I actually thought, oh well, if I'm gonna have a C-section, if I need to have a C-section, or I know I'm gonna have an epidural, maybe it's not hypnobirthing, it's not for me. But actually, that's a really good way of thinking about it. It gives you still that control, even if you're having these things. So it's a great thing to learn, even if you're not having a natural childbirth, which is what people seem to think you want for hypnobirthing. So that is a big misconception. I had that misconception. I didn't realize.
It's simple things like just the breathing. You can if you know that you've got some way to technique to breathe. It's just wonderful. Your you're flooding your body with, you're able to relax. You're more comfortable. Your birthing partner's more comfortable.
Yeah.
It's and it's things like it doesn't mean you can't have like skin to skin contact with your baby afterwards. It's allowing you to have those conversations with your care provider to say, okay, you know what, I might not be able to have a natural birth, but I'd like to skin bonding. It might not be on me, but it can be on my birthing partner. So it's still giving those options, and then you've still got some sort of say in the birth of your baby.
Yeah.
So that's very powerful. And it doesn't mean so, well, what if I end up having Pitocin or wanting an epidural? Then I haven't hypnobirth. Well, no, that's not the case. It's you've gone into that because you think it's the best thing for your labour. You've asked those questions, you've weighed the risks and the benefits, and you've chosen that, and that's very, very empowering to the woman. Is you have hypnobirth. You have you've used what you've learned in class and provided it. You've used it in your labour.
And the situations that end up being for your birth experience, those are the fact that you still have the control to make those decisions and you're in that relaxed state. That is having a hypnobirth birth.
Absolutely.
So, yeah, no, that's absolutely wonderful. But we're coming kind of to the end of this interview. So I did want to give you a chance, if anybody listening and anybody watching really wants to find you, where can they find you? What kind of things do you do locally and online?
Okay, so my website is www.calmholisticbirth. So it's CALM holisticbirth, all one word.com. I teach classes in the Houston area. Mm-hmm. But if you're not in Houston, you can go onto the HypnoBirthing Institute's website and find a practitioner that's near you. And I teach group classes, private classes, and I also teach hypnomothering classes because I think that's an excellent continuation from the hypnobirthing classes. So yeah, and what I like to do with my mums is if they come early on enough during the pregnancy that they want to have a refresher afterwards or something, you can come to class again afterwards and do that for free. I'm there to support mums during the whole entire pregnancy, not just so that they just walk away from the class if they've got questions. They're welcome. I'm there to support them.
Yeah. So that's great. So if people want to find you, they can find you on your website. I'm sure they can send you an email, ask any kind of questions. And if they are lucky enough to be local in the Houston area, they can find your classes, which is absolutely wonderful as well.
Absolutely.
Thank you so much, Elisabeth, for being part of this and sharing your knowledge about hypnobirthing. Thank you again.
Thank you, Nara, for the opportunity. It's been wonderful talking to you. And I hope it's helped mums sort of provide choices for mums and sort of look into it a bit more.
I think it definitely has.
Thank you.